And now for my tips on the bra cups. So first off, you want a breathable fabric. So cotton is really nice because it'll keep you cool. And what I would suggest is that you get the cup of the bra is fully covering your breast. Yeah, so that's first off. So what I mean there is that you're not bulging out over the sides or you're not bulging out over the front. Yeah, so all of your breast is fully contained in the actual cup. So always look at your natural breast side first, and then your breast care nurse will probably give you something called a pry-form, or it's often called a softie as well. And here are my little tips for the pry-form. So the pry-form is very lightweight, and it's filled with this fibre filling. And it can be quite bulky when you first get it, but you don't have to have it the shape that it is. So my suggestion here would be to actually remove some of this filling. So it's very easy to remove. So say for example, if your natural breast is very shallow on the top, which a lot of us are, then I would suggest that you take all of the filling out of the top, as I've done here, and then you put more filling on the bottom. Or if your breast is very rounded, then you pop the filling back in, and what you're trying to do is match it to the other side. So I'll show you with the bra. So with this particular bra, we've got pockets. Yeah, so it's a pocketed bra, but you don't have to use a pocketed bra. If you haven't got a pocketed bra, you can just slip it inside the bra cup. But if you have a pocket, then you just pop it in like that into the pocket. Now, what often happens with these is if you have a little bit of space in the pocket, then usually, because your pry-form is very light, it usually moves around. Or if you don't have a pocket, it usually moves around and it moves right up to the top. So often women come to see me for their prosthesis fitting, and they've been wearing this for maybe 6 to 8 weeks, and it's up here. So it's not symmetrical with their natural breast. So what I would suggest is you just get a little bit of needle and cotton, and you really just put a few little stitching around the edges and sew it onto the inside of the bra, and that'll keep it in place. So a couple of tips there now. So sew it in so it'll keep it in place, and then your filling inside, just adjust that according to the shape of your natural breast. And when you're washing your bra, remove all of this filling, before you wash it. So there are my little tips there. And if you want to check if you're symmetrical, the other thing I would suggest is not to look in the mirror, but to actually put on the bra, put on your pry-form, and then look down at your breast and get your 2 index fingers, and just as if it was a ruler, go straight across in a line and just check to see if you're symmetrical, but looking down rather than looking in the mirror. And then get your favorite top and try it on and see, do you like the shape? Now, if you've had a double mastectomy, then you'll have 2 pry-forms, and what you can do is you can adjust those to the size that you would like. Make sure both of them are the same. And then if you've had surgery and you've had a reconstruction, then I would suggest that you follow all the tips that I've said about the bras, but you probably won't be wearing the pry-form. But what I would suggest is that during this time that you would wear a compression bra. So again, in the links on the Future Dreams website and in the bio, and check them out, and go straight in for into post-surgery on any of the brands' websites, and you will see that there's quite a few compression bras there as well, and they're really good, and they're very soft, but they're offering really good support post a reconstruction. And then if you're concerned about your prosthesis fitting, because usually you would wear your Priform for about 6 to 8 weeks, and then your breast care team would send you to outpatients for your prosthesis fitting. Now, don't worry. Outpatients may not be doing the usual fitting at the moment. You can actually wear your Priform for longer than 6 to 8 weeks. So you can wear this until you get your appointment for your prosthesis fitting. And then when you get your prosthesis fitting, you can actually wear the bra that you were wearing for that time post your surgery, or you can check out the links and you can bring a new bra. And if you are going for a prosthesis fitting, at the beginning, wearing a pocketed bra probably will make it a little bit easier. And also remember that with the prosthesis, it will be a little bit heavier because it's made of silicone. Yeah, so it won't be as lightweight as this. So it'll be easier to actually stay placed in the bra, and you won't have to do any stitching with that. And it's very, very easy to look after as well. And the key with your prosthesis fitting is when you do go for your prosthesis fitting is, again, like what I said, is to always fit to the natural breast first. So make sure that your bra fits you on the natural breast first, and then get your prosthesis to fit on the other side, and get a similar shape to the shape of your breast. And now, my other big tip is, please don't throw out any of your old bras. You may have beautiful bras, and every time you look at them in the drawer, you might think, oh, I'll never wear those again. Or maybe somebody's told you you'll never wear them again. Please, what I would suggest here is to just take those bras and put them into a little box or a little bag and put them in the back of your cupboard or your wardrobe, and take them out when everything is healed, and then try them on again and see if they're suitable. But don't throw anything out at this stage. So there are my tips. I hope you find them helpful and useful. As I said, there are many brands out there, but we've included lots of them in the bio for you to check out. And also check out the Future Dreams website and the wonderful work they're doing, and I'm sure there's some really useful information there for you too. And thank you so much for listening.